I think what sticks out about Andrews Sports Medicine is that our approach to the care of our patients, whether athletic patients or not, we pretty much treat all patients as if they're athletes. I'm Dr. McGough. I'm one of the orthopedic surgeons here at Andrews Sports Medicine and Orthopedic Center. I grew up here in the greater Birmingham area. I'm from a small town called Mount Olive, which is just north of Birmingham. My introduction into orthopedics kind of came when I suffered a knee injury when I was in high school. I tore my ACL. I was really kind of intrigued by the ability for an orthopedic surgeon to restore function because when I suffered the injury, I thought that was going to be it for me as far as playing sports. I went to college at the University of Alabama, studied pre-med there, and I did my medical school training here at Birmingham at UAB, and then after that I applied for and got a residency at Dartmouth. I was looking forward to getting back here to the South, and so I applied for a sports medicine fellowship and was fortunate to be accepted here at the American Sports Medicine Institute. So that was a unique experience, getting to learn under doctors like Dr. Kane and Dr. Dugas, as well as Dr. Andrews, and just seeing how they interact with their patients and interacting with the athletes and the parents of the athletes, and that really was very helpful in figuring out how to incorporate that into my practice. We're called sports medicine specialists or subspecialists, but really we're just treating all walks of life. You don't have to be an athlete. It's just anybody who enjoys being out and being active, and that could be it could be golfing, could be playing sports, could be just going for hikes, whatever it is. But in general, it's the idea of trying to restore function to an active individual. More common injuries that I see would include rotator cuff tendonitis, rotator cuff tears, labral tears, bursitis of the shoulder. Those are some issues that I frequently am taking care of. In the knee, I take care of meniscus tears and ligamentous injuries such as ACL tears or MCL tears, PCL tears. But I also really enjoy taking care of arthritic joints as well, and so that includes not just younger patients but the older active individual as well. So people who are having early arthritis symptoms, you can do some things that are minimally invasive to address that initially, but if the disease progresses, then you can treat that with joint arthroplasty or joint replacement surgery. And so I do specialize in treatment of arthritic conditions of the knee as well as the hip and the shoulder, and do some special surgeries in shoulder replacement that involve replacing the shoulder when there's not a rotator cuff present. That's called a reverse shoulder replacement, and I'm one of the physicians here in the group that is capable of taking care of that condition.
Number 10, Marcus Webb on the carry.
Every weekend during the fall, much to my wife's dismay probably, I'm on the sideline somewhere, and so Friday night I cover Spain Park High School, which is a local 7A high school. So it's always fun to be back on the sidelines, not having done this now for, as an athlete at least for many years, but it's fun to be out there with the athletes and kind of enjoy their highs and lows as the season goes on. And of course it's very rewarding to be able to restore the function to those kids when they have injuries, just like I experienced when I was in high school. I think when it comes to patient care, I think just the general kind of golden rule approach is appropriate. I think people want to be treated, the way that you'd want to be treated.